Cardiovascular Drugs Pharmacology for Nursing, 15 Practice Questions Answers with Rationales. Question 1. A patient with heart failure is on spironolactone 25 mg daily and lisinopril 20 mg daily. The patient reports muscle weakness and cramping. The nurse reviews the lab work. Which value requires immediate intervention? Option A, sodium 135 milliequivalent/L. Option B, potassium 5.9 milliequivalent/L. Option C, Bun 22 mg/dl. Option D, creatinine 1.1 mg/dl. The correct answer is option B, potassium 5.9 milliequivalent/L. Potassium 5.9 indicates life-threatening hyperkalemia due to potassium-sparing diuretic plus ACE inhibitor effect. Question 2. A patient is prescribed clopidogrel after a drug-eluting stent placement. The patient says, "I have heartburn and I bought over-the-counter omeprazole." What is the nurse's best response? Option A, omeprazole is safe to take with clopidogrel. Option B, take omeprazole 2 hours apart from clopidogrel. Option C, you cannot take omeprazole because it reduces clopidogrel effectiveness. Option D, ask your cardiologist to switch you to famotidine or Pepcid. The correct answer is option D, ask your cardiologist to switch you to famotidine or Pepcid. PPIs like omeprazole inhibit CYP2C19 and reduce clopidogrel activation. Famotidine is safer for acid control. Question 3. A patient on warfarin for atrial fibrillation has an INR of 4.5. The patient has no bleeding. The nurse holds the warfarin. The provider orders oral vitamin K 2.5 mg. The patient asks why such a small dose. What is the best response? Option A, large doses of vitamin K cause blood clots. Option B, small doses lower the INR slowly without causing warfarin resistance. Option C, large doses would reverse the warfarin too quickly and cause a stroke. Option D, small doses allow the INR to drop exactly to 2.0 every time. The correct answer is option C, large doses would reverse the warfarin too quickly and cause a stroke. Small doses of vitamin K correct INR gradually, preventing sudden loss of anticoagulation protection. Question 4. A patient with hypertension is started on hydralazine. 3 months later the patient develops joint pain, facial rash and fever. The nurse suspects drug-induced lupus. What is the priority action? Option A, draw ANA and antihistone antibodies. Option B, give ibuprofen for joint pain. Option C, stop the hydralazine and notify the provider. Option D, refer the patient to rheumatology. The correct answer is option C, stop the hydralazine and notify the provider. Hydralazine-induced lupus resolves after stopping the medication. Discontinuation is the priority action. Question 5. Margaret is 78 years old. She has atrial fibrillation and a CHA2DS2-VASc score of 5. Her doctor prescribes apixaban, Eliquis. She fears bleeding from falls. What is the best response? Option A, you should switch to warfarin. Option B, you should avoid all blood thinners. Option C, stroke risk is higher than bleeding risk from falls. Option D, aspirin is safer and equally effective. The correct answer is option C, stroke risk is higher than bleeding risk from falls. Stroke risk from untreated atrial fibrillation is significantly higher than bleeding risk from DOAC therapy. Question 6. Robert is 65 years old with heart failure. He is admitted with fluid overload. Metoprolol is held but cardiologist restarts it. Why? Option A, it increases heart rate to improve output. Option B, withdrawal causes rebound sympathetic activation. Option C, it improves oxygen saturation directly. Option D, it replaces carvedilol therapy. The correct answer is option B, withdrawal causes rebound sympathetic activation. Abrupt beta blocker withdrawal can cause rebound tachycardia and worsen heart failure outcomes. Question 7. James is 58 years old. He has hypertension and takes lisinopril daily. He develops knee pain from arthritis. He buys over-the-counter ibuprofen and takes it for 2 weeks. He returns to his doctor's office with blood pressure of 184/102. His blood pressure was 128/74 2 weeks ago. What happened to James? Option A, James developed a new kidney problem. Option B, ibuprofen blocked the effect of lisinopril. Option C, James stopped taking his lisinopril. Option D, ibuprofen caused fluid retention and weight gain. The correct answer is option B. Ibuprofen blocked the effect of lisinopril. NSAIDs like ibuprofen reduce prostaglandins, which decreases the effectiveness of ACE inhibitors like lisinopril, causing loss of blood pressure control. Question 8. Patricia is 72 years old. She has a mechanical mitral valve. She takes warfarin daily. Her INR is 1.8, goal 2.5 to 3.5. She also takes amiodarone. Provider orders warfarin increase. What should the nurse do? Option A, give increased dose. Option B, give usual dose. Option C, hold warfarin. Option D, call provider about interaction. The correct answer is option D, call provider about interaction. Amiodarone increases warfarin levels unpredictably via CYP inhibition, making dose increases unsafe without adjustment planning. Question 9. David is 45 years old. He takes lithium 900 mg daily. Hydrochlorothiazide is added. 1 week later he has confusion, slurred speech, tremors. What is the cause? Option A, manic episode. Option B, Parkinson's disease. Option C, lithium toxicity from HCTZ. Option D, silent stroke. The correct answer is option C, lithium toxicity from HCTZ. Thiazide diuretics decrease lithium excretion, causing toxicity even if previous levels were therapeutic. Question 10. George takes atorvastatin 80 mg daily and eats grapefruit daily. He develops muscle pain, dark urine, CK 15,000. Cause? Option A, viral myositis. Option B, grapefruit increased atorvastatin causing rhabdomyolysis. Option C, statin allergy. Option D, dehydration. The correct answer is option B, grapefruit increased atorvastatin causing rhabdomyolysis. Grapefruit inhibits CYP3A4, increasing statin levels and causing rhabdomyolysis with muscle breakdown and kidney risk. Question 11. Carol receives 4 amiodarone too fast, 30 SEC instead of 10 minutes, and develops hypotension and arrest. What went wrong? Option A, cannot be given forever. Option B, too fast push caused vasodilation. Option C, wrong drug used. Option D, contraindicated in VT. The correct answer is option B, too fast push caused vasodilation. Rapid forepush of amiodarone causes severe vasodilation and hypotension due to solvent effects, polysorbate 80. Question 12. Eleanor on heparin develops platelet drop from 250 to 80 and new black toe. What is happening? Option A, arterial clot from DVT. Option B, hit with arterial thrombosis. Option C, infection. Option D, vasculitis. The correct answer is option B, hit with arterial thrombosis. HIT causes paradoxical clotting despite low platelets, leading to arterial thrombosis and tissue ischemia. Question 13. Frank stops clopidogrel after stent placement for dental procedure and develops stent thrombosis. What went wrong? Option A, should stop aspirin instead. Option B, dental procedures require stopping all antiplatelets. Option C, needs 12 months uninterrupted dual therapy. Option D, should have bridged with enoxaparin. The correct answer is option C, needs 12 months uninterrupted dual therapy. Drug-eluting stents require at least 12 months of uninterrupted dual antiplatelet therapy to prevent thrombosis. Question 14. Helen on digoxin plus furosemide has vomiting, yellow vision, K3.2. Priority intervention? Option A, stat digoxin level. Option B, for potassium replacement. Option C, stop furosemide and give DG bind. Option D, give antiemetic. The correct answer is option B, for potassium replacement. Hypokalemia increases digoxin toxicity risk. Correcting potassium is the immediate life-saving priority. Question 15. Carl is 44 years old. He is on a propofol drip for sedation in the intensive care unit. On day 3, his nurse notices his triglyceride level is 800. His CK is 10,000. His urine is cola-colored. His heart rate is 130 and BP is 70/40ths. What is happening to Carl? Option A, Carl has sepsis from his 4-line. Option B, Carl has propofol infusion syndrome. Option C, Carl is having a pulmonary embolism. Option D, Carl has malignant hyperthermia. The correct answer is option B, Carl has propofol infusion syndrome. Propofol infusion syndrome is rare but deadly. It causes metabolic acidosis, high triglycerides, rhabdomyolysis, and cardiovascular collapse. Stop propofol immediately. Question 16. Doris is 76 years old with HFrEF. She takes lisinopril 20 mg daily. Her cardiologist wants to start Entresto, sacubitril/valsartan. What must happen before starting Entresto? Option A. She must stop lisinopril for 36 hours. Option B. She must take both drugs together for a week. Option C. She must double lisinopril first. Option D. She must have a normal echocardiogram. The correct answer is option A. She must stop lisinopril for 36 hours. Entresto, ARB plus neprilysin inhibitor, cannot be given with an ACE inhibitor due to risk of fatal angioedema. A 36-hour washout is required. Question 17. Henry is 63 in cardiogenic shock. BP is 70/40ths despite fluids. Why choose dobutamine over dopamine? Option A. Dobutamine is an inotrope. Dopamine is a vasopressor. Option B. Dobutamine increases contractility without raising HR. Option C. Dobutamine is for push. Dopamine is a drip. Option D. Dobutamine is beta-1. Dopamine is dopamine/beta/alpha. The correct answer is option D. Dobutamine is beta-1. Dopamine is dopamine/beta/alpha. Dobutamine mainly stimulates beta-1 inotropy. Dopamine has dose-dependent receptor effects, dopamine, beta, alpha. Question 18. Phyllis is 59 with Torsades de points. After defibrillation, it returns. What next medication? Option A. Amiodarone 4 push. Option B. Lidocaine 4 push. Option C. Magnesium sulfate 4 push. Option D. Epinephrine 4 push. The correct answer is option C. Magnesium sulfate 4 push. Magnesium sulfate is first line for Torsades even if magnesium level is normal. It stabilizes cardiac conduction and stops recurrence.